Welcome back. Nice seeing you all again. So today we're in our fifth module, and what we've been doing so far is focusing on the policy forum and the actors, the policymaking process, marketing and messaging, and also the advocacy tools, the tools that we use to promote our policy action plan. So that is our overall framework, and I provided you frameworks within each of those contexts to help you just analyze and identify how to create an advocacy initiative, a public health, public policy advocacy initiative. Today what we're going to do is continue our conversation about advocacy. And as we discussed last time, our commodity is information. That's what we bring to the table as public health professionals, as advocates, as policy advisors, as technicians. We have the information that those around the table don't have on any given topic. I've been using obesity prevention as the example throughout the modules, but any example really would work for that. So if our commodity is information, what we've been talking about is collecting and gathering info. And we talked about hard research and soft research. So this is our data and evidence base. And this is our policy paramours and stakeholders, etc. We've then talked about analyzing the information that you collect. What does it mean for the specific initiative that you are working on? Third, we talked about assimilating information into the assimilation tools or advocacy tools that we talked about in the last module. And here we're talking about the currency, if you will, called fact sheets. We talked about media releases. We talked about correspondence, etc. Today, we talk about the last step in the policy action planning process, and that would be delivery. Delivering information. And like the other modules, I have created a framework by which we can really analyze and discuss the delivery of information. This is perhaps the key component of an effective policy action plan. It's how we get the information to policymakers, to stakeholders, to interested parties, how we get the attention on our initiative after we have assimilated and really built our fact sheets, we've created our market and messaging, we've created our attention getters. Now how do we actually go about delivering the information? And what I want to talk about, and to frame it a little bit, is I'd like to talk about it in the context of what I call, and we're talking about delivering information. I like to talk about it in the context of what I call the continuum of formality. That's the framework. The continuum of formality. So for instance, at the top of the continuum is very formal delivery. At the bottom of the continuum is very informal delivery. And what we'll talk about for the rest of this module is those elements in between. So at the very top, the most formal type of delivery is testimony. And our next module will break down testimony and actually kind of analyze and evaluate what I mean by providing formal testimony on a policy initiative. But testimony to me is very formal. So there's very specific ways in which we deliver the testimony. Testimony is delivered primarily at hearings, which is a very technical term, and a very formal avenue, a hearing, and that's where we present our testimony. So we can see that it's at the very top of the continuum of formality. What I like to do, and again we'll talk about this more in the next module, but I have a formula for delivering testimony. It should be written out, it should be read, delivered in a way that, again, as I mentioned last time, balances fact and emotive. We talked a little bit about that last time, and we will talk again about it next time. And there is a need to be short and succinct and precise with our testimony. It's very formal. We address the policymakers in their formal title, and we act in a very formal way when we're delivering testimony. So that's at the top of the continuum. At the bottom of the continuum is very informal communications with policymakers. And this is perhaps the most critical component of an effective policy action plan, is strategically thinking about how you take advantage of those informal opportunities to work with policymakers. Much of this informal delivery revolves around relationships. Relationships. Relationship management is absolutely critical in the policy advocacy context. You only have your reputation, and policymakers are public servants. They appreciate the fact that you're coming to them with passion and energy about a topic like obesity prevention or substance abuse or health disparities or imprisonment. There's so many issues that we deal with on a daily basis in public health, and policymakers appreciate the fact that we're the technical assistance providers on those topics. So they look to us for getting that information. They look to it through formal testimony, but they also look to it just through the relationships that we have. And there's many ways of developing those relationships. You look at policy makers and try and establish relationships based on many factors. Folks that live in the community that you live in. Folks that went to the same higher ed institutions or schools that you went to. Folks that have the same hobbies and interests that you do. So all of that helps build the relationship. And these relationships are absolutely key to the delivery and effective action planning for a policy initiative. Now, when I talk about informal, one of the things that we look at in terms of informal communications is something like sitting at a bar with a policymaker. That's an informal, probably the most informal communication. At the end of a day, you are in the state capitol or at City Hall, you have an opportunity to run into a policymaker at a cocktail lounge or at a bar, and you have an opportunity then to really work on your initiative. This is informal. And one of the things that I want to emphasize is that alcohol and food play an important part in the policymaking process. It's one of those things that's kind of usually under the radar, but I like to talk about it openly. And I like to talk about it in the context of being strategic. You know, if you decide to drink a lot with a policymaker, that can cause some issues sometimes. Again, it's all about your relationships. It's all about your reputation. So you have to be careful how you take advantage of these informal opportunities to meet with policymakers. So the amount of alcohol that you decide to consume at any given time with the policymaker is a strategic issue. For instance, if the policymaker is drinking a cocktail and you decide not to drink a cocktail, that might impact the relationship. I'm not in any way encouraging alcohol consumption. I'm just saying these are strategic decisions that you have to make as a good advocate. So alcohol does play a role. Food plays a role. And again, there are ethical considerations in terms of the Gift Ban Act in the state of Illinois that limits the amount of money that you can spend on a policymaker for a meal, but it's something that you should look into and understand. So at the informal level, we have things like food and alcohol that help drive that relationship management. And it's something that I really don't want to, again, overemphasize, but it is very important to remember. Now, up and down this continuum are many, many other types of delivery. And we can think about some of the advocacy tools that we talked about in the last module. And of course, if you think about the fact sheet, delivery is handing the fact sheet to the policymaker. The letter or email, sending the letter or email to the policymaker. Testimony, delivering the testimony at a hearing. So there's a direct linkage between the advocacy tools that are assimilation tools and the delivery of those tools. So those are obvious. Now, I will mention that there are always strategic decisions to be made. And that's why you can't overthink these things, really. And you can't really over-prepare for these meetings with policymakers and how to address your advocacy on any given initiative. So for instance, one strategic decision to be made is if you draft an email to a policymaker, when do you send it? Oftentimes I've had success, for instance, on sending emails late at night or after the workday. Because oftentimes policymakers will check their own emails. And if you send an email at midnight, that's when policymakers are checking their email. I can tell you that policymakers, and this kind of rubs against the general kind of feeling about politicians these days, and that's why I talk about politicians in the frame of a policy maker. Because I can tell you from my experience that policymakers are extremely hardworking. They're dedicated to the public good. They're very interested in the issues that you and I work on a daily basis. And so these are very hardworking people. These are people that are checking their emails at midnight. So when to send the email? Who checks their emails? We know that certain policymakers are very technologically savvy. They may check their text. They may check their emails. That's a strategy decision. I'm working on an issue right now where I know that the sponsor of the initiative is a text-savvy guy. So he checks his text all the time. I don't really even need to make a phone call. I can text him, and then he responds that way. So I'll add text here on our advocacy tools. We didn't have that last time. So back onto the continuum, and these will fit in the continuum. In the middle of the continuum is really what we consider meetings. Meetings with policymakers. And these take many formats. So for instance, one of the points of inquiry of a meeting is, do you meet at the policymaker's district office or local office, or do you meet with the policymaker at their official office, like for instance in Illinois at the state capitol in Springfield, or in the city of Chicago at City Hall, or even at the federal level, do you meet with the congressman in their district office, or do you go to DC? Again, it's a very strategic decision to be made. Oftentimes, I like to think if you're working on an issue kind of generally, like if I'm going to talk to a congressman about the hard work we're doing on obesity prevention in Illinois and the importance of making it a federal issue, then I might meet with them in their district office to really drive home the point that this is a community-based local issue. If I'm working on a specific initiative, a bill or a policy initiative at the federal level, I might actually go out to DC and meet with the congressman in his office to talk about House Bill 1234, our obesity prevention initiative. So, you know, it depends on the issue, and it's very strategic where you have that meeting. It's also strategic who attends that meeting. Do you have key stakeholders there? Do you have your partners there? Do you go alone? These are issues. For instance, one of the things I'm working on a adolescent alcohol substance abuse prevention initiative right now. One of the things that we always grapple with is, at what point do we bring adolescents, kids, to meetings, or kids to testify? So again, these are strategic decisions to be made. Another strategic question is, who leads the meeting? Do you, as the technical assistance provider, kind of that person that's behind the scenes pushing this policy initiative, do you take the lead on the meeting? Or do you let the CEO of the stakeholder group take the lead? Again, you need to check your ego at the door when you're dealing with these policy initiatives, and especially in an action-oriented approach. You must check your ego, and you must remember that those relationships are key. So meetings are, you know, less formal than testimony, but more formal than those cocktail hour dinners, that type of thing. So very, very important component of the delivery of our advocacy tools. And again, within those meetings, you would want to bring a fact sheet to hand out to the policymakers. Down the continuum, you have things like fundraisers or other types of public events, speaking events, conferences. You do your research, and again, this is part of the soft research that I talked about in collecting information. Find where the policymaker is going to be. Be opportunistic. Figure out if they're going to be speaking at a conference. Go to the conference, sit in the back, go up to the person after the speech and let them know that you're working on obesity prevention or whatever the topic is. So these are kind of, again, more informal. One thing that I want to emphasize is that as part of your delivery, you want to really work on what some people call an elevator speech. I call it a bus stop speech. And the reason why I call it a bus stop speech instead of an elevator speech is that most of my work is in the community. And when you go to the west side and south side of Chicago, oftentimes there aren't elevators. So it's a contextual thing. And even when there are elevators, oftentimes those elevators aren't working. So more often than not, you're going to be talking to somebody in the context of a bus stop, if you will. A 2 to 3, a 1 to 2 to 3 minute summary of your initiative. It's a very difficult thing. I'll give you an example. I was in the state capitol yesterday, and I was able to meet with a person that I've developed a relationship with, the minority leader of the House of Representatives, a person I've worked with on diabetes, other issues, education issues for many, many years. He's a very, very busy guy. I told him I was there. I went to his office, so I did not have a scheduled meeting. I had an unscheduled meeting. And Representative Cross came out of his office where he was in the middle of a meeting, and he said, I'm in a meeting, but I wanted to come out and say hi to you. What can I help you with? I didn't say, how's the family? How's the kids? How are you doing? How's your health? I went straight into, I'm here on this issue. Okay? Can we have your support on this issue? It took 30 seconds to do that. And it was very effective, and he took it under consideration. I got his attention. So you have to remember that while you're developing these relationships, the policymakers oftentimes are extremely busy. They may be working on 1,000 issues at one time. And one of the things is how you get your issue to rise to the top. So the unscheduled meeting is one of those really kind of very important components. In Springfield, we have what's called hanging at the rail. And for those of you that are not from Illinois, your state capital may have a similar thing. But it's important to know what hanging at the rail means. Outside of the House and Senate chambers in Springfield is a big rail. And what happens is that when the House members and Senate members are in session, they're on the floor, you can actually put in a business card and you give it to the door manager, the person that's watching the door, and they give it to the policymaker, and the policymaker comes out and talks to you. It's very informal, and it's a very kind of insider way of getting things done. But the most powerful lobbyists hang at the rail. Even though they can go into the office and have these meetings, all of these types of communications are within the toolkit of the most powerful lobbyists and the most effective public advocates. We know that oftentimes it's best to talk to a policymaker at the rail. It's part of what we do. So one of the things that I like to talk about in terms of informal towards down at the bottom, and of course there's other things like, you know, golf outings and sporting events and other types of events that policymakers are interested in, and again, that goes back to that kind of soft research. Where do policymakers hang out, and how can you use that to your advantage? One thing down at the bottom also of the informal is running, what I call running into. And basically what that means is that policymakers live in communities. They're out and about on Saturdays and Sundays. And oftentimes you can take advantage of that as an opportunity. You know, and not everybody, you know, uses these tools. I am a little bit more aggressive because I'm very passionate about public health and public education. These are topics that mean a lot to me, and I'm willing to spend my time, my thought time, 24/7, any opportunity I get to, you know, really knock home the point. So for instance, I have stopped policymakers in the grocery store parking lot to talk to them about an issue. And again, I go back to my bus stop speech. Rep, it's great to see you. I'm working on this obesity prevention bill. Can I have your support? And if you have them in a parking lot on a Saturday, they're going to say either yes, no, or send me more information. And then that gives you some direction that you can take. I'll give you one war story that comes out of my own work. And I was working on a piece of legislation a few years back, and it was a Saturday afternoon, and I was cruising up the street in the town that I live in, and I saw a very powerful senator walking the other way. I slowed the car to catch the red light. I got out of my car, opened my trunk, pulled out a fact sheet, basically ran over to the senator and said, Senator Dillard, it's so good to see you. I'm working on this really interesting issue. Here's the fact sheet on it. In a nutshell, here's what it does. I look forward to your support. I hop back in the car and the light turned green, and the senator, before I left, said, I will support this. That quickly. And sure enough, on Monday, Senator Dillard had signed on as a sponsor to this legislation, based on that very informal running into. So again, as we move back up the chain, the continuum of formality, these are the more formal letters and other types of scheduled conferences where you actually do a presentation, like a PowerPoint presentation, different than a meeting where it's just sitting in the office and kind of, you know, talking. Oftentimes you'll have very kind of formalized presentations. And oftentimes what we do are what are called policymaker events. So for instance, I often advise folks to work on things like a legislator breakfast, where you bring in legislators, a number of them, to your organization, and you have a nice spread of a breakfast, a healthy breakfast hopefully, and you have folders that you actually give to legislators, and you go through your policy priorities, you hit upon your highest priorities, and you have then shown the policymakers that you take what they do seriously, that you have prepared, that you are very, that you're very focused on this issue, and policymakers appreciate that. So this is the continuum of formality. It's a very critical piece of the puzzle, and I've been happy to share my insights on this with you. It's kind of the insider game on advocacy, but I like to share it with students and other folks because I think that it's important to be prepared. One of the things in closing today that I'll say is that the concept of a policy action plan is to be successful. We were able to get our BMI surveillance legislation on the books. We've been able to get other obesity prevention legislation on the books. We have other work that I've done, particularly around bullying and other issues where the actual policies are on the books. And part of that is knowing how to manage those relationships and knowing at what point to come in and deliver your information effectively. So with that, of course, I'll be posting some assignments and exercises in the resource room and some other resources as well, and look forward to the next module. Thank you.